Welcome back, guys. As if people needed another reason to quit smoking or dipping, doctors say tobacco is responsible for 85% of oral, head, and neck cancers. This weekend, you can get a free screening to find out if everything is okay. Dr. Ron Carney is a head and neck cancer surgeon with UT Physicians at Memorial Hermann. He joins us now with why the screenings are so important. Doctor, thank you so much for joining us.
Thank you for having me.
So first, let's talk about Oral, Head, and Neck Cancer Awareness Week. Tell us about that.
Well, this is an important event. We expect about 70,000 new head and neck cancers in the United States this year.
Wow.
And so we want to make the opportunity for folks to come out to a dedicated head and neck cancer center like ours, and if they have some suspicious signs or symptoms, to get those looked at.
And talk about some of those symptoms. What are some of those things that people should look out for that they may not necessarily think would be cancer?
Right. So head and neck cancer includes a bunch of different types of cancer, but the one we really focus about a lot these days is throat cancer, which is rising in incidence. We see many more of these now than we did in the past. And what makes this disease interesting is that sometimes you can have very few symptoms. So you can have a tumor in your throat and not have a terrible sore throat. A lot of these patients actually develop a lump in the neck that's painless. And what we want to encourage people to do is, if you have a lump in your neck and it's been there more than 2 weeks, to please go seek the attention of a doctor for that.
And they can get those free screenings coming up. Let folks know about those, because that's so important. Because if you're kind of not sure, you're kind of thinking, well, I have a lump, but it doesn't bother me, it doesn't hurt.
Correct.
They should go.
Yes, and so we throw our doors open at noon on Friday this week at the McGovern School of Medicine Department of Ear, Nose, and Throat in Memorial Hermann Hospital in the Medical Center. And during that time, anybody can come and speak to one of our doctors about a sign or symptom they have that might be associated with head and neck cancer.
And don't be scared, right? Because the sooner you get it, that's better.
Yeah, the whole idea of screening is to pick these up early. Patients, of course, who get identified early with head and neck cancer get less treatment and have a better outcome, better chance for survival.
All right, Dr. Ron Carney, thank you so much for coming out here and joining us this morning. And you can find all this info and check out a replay of this interview at clicktohouston.com. It'll be posted under our video tab on our homepage a little after the show.